Hello, my name is Arlene Ortiz, and the title to my speech is called The Right to Die. So briefly, I just want to persuade you all into thinking about legalizing assisted suicide for terminally ill patients. We will be touching the process of assisted suicide, the pros of legalizing assisted suicide, and finally knowing the effects of having options of legal assisted suicide for the terminally ill. So, up to date, there are only 6 states that allow legal assisted suicide. Those states are California, Colorado, Montana, Oregon, Vermont, and Washington. Just before I jump into everything, I just want you all to consider that there should not be any restrictions on patients who are terminally ill wanting to die. Alright, so the process of assisted suicide. So that is entitlement of death for terminally ill patients. The government should not have control over terminally ill patients' passings. This is a brief definition. The process by which a physician administers lethal drugs to a terminally ill patient. This was given by B.R. Samara, a journal entitled To Legalize Physician Assisted Suicide or Not. So knowing what assisted suicide briefly is and knowing that the government should not suppress this. This is also taken by D. Benatar, a PhD, in the article There Should Not Be a Legal Right to Die. The right to die need to be interpreted as a right to be prevented from being assisted by those who are willing to help. In other words, those who think assisted suicide is immoral should not be asked to help kill others. That's also a reason why assisted suicide is not legal in all the other states, because it's hard to find physicians who are willing to go through with this whole process. The whole process is pretty lengthy, but I've condemned it in just four steps. So the first one is actually just being eligible. So you have to be terminally ill with 6 months or less to live. Secondly, you actually start going through the whole process of it all. So you talk to a state certified physician. Next, you go into the state actually requires for the terminally ill patient to do 2 oral requests. It's the first oral request followed by a 15-day waiting period. That period is so the patient actually accepts, or if they do decide to change their mind, if they want to prolong their life, whatever option they have left, they will be able to take it without being penalized. Finally, it's the second oral exam. Then after that, the medication is prescribed for the aid in dying, and that medication is self-administered, but your physician will be there while you are taking this medication. And lastly, I just kind of want to touch into the doctor and patient relationship. Is the best actually for the patient, of course. Terminally ill patients who are able to discuss sensitive issues with their doctors are able to instill trust. This quote was taken from an article by the Lone Star College called The Right to Assist Suicide. They also state that a terminally ill patient consenting to assist suicide knows that a doctor's job is to relieve pain. Giving consent to a doctor shows great trust. Which is also true because this is such a sensitive issue, especially for a terminally ill patient. So up to now, I've given you a brief definition of what assisted suicide is and the importance of the process, as well as the relationship between a doctor and a patient. Now I kind of want to jump into the pros of legalizing assisted suicide. So as I've mentioned, 6 states have legalized it. These states have passed some type of billing allowing this option to be legal. All these states require basic guidelines, and as I've mentioned before, this was taken from procon.org, an article state by state guidelines to physician assisted suicide. Now we're going to move into experts in the medical fields that speak of pros of legalizing assisted suicide. There are debates over this topic since it's very controversial. There is a debater from Italian Intelligence Debate. His name is Clarence Braddock. He's an MD, and he argues there are 5 favors of legalizing assisted suicide. The first one he states as respect for anonymity. Basically, he's just saying terminally ill patients are still competent and have the right to choose the timing and the manner of death. Second is justice. Not all terminally ill cases are the same, and this option, when actually thinking about it, should not be suppressed from the patient. Third is compassion. He simply states that nobody wants to see their loved ones in pain and suffering. Fourth, he talks about individual liberty, that he's addressing to more of the states and the government, saying that they should not take away the right to a terminally ill patient of death. And finally, it's just honesty that promotes trust and communication between a patient and a doctor on such a sensitive issue. There is also another, he's not a debater, but he is a professional. His name is MD Enrich Lowy. He's also from procon.org, but this is on an article named Should Euthanasia Physician Assisted Suicide Only Be Allowed for Terminally Ill? And basically all he states is that I will argue time has come to consider voluntary suicide. It must come under circumstances in which death of the individual is reasonably felt to be inevitable. So he's saying if you know you are terminally ill and you are going to pass, there should be options for you that should not suppress you from doing what you feel is right. And finally, I kind of want to just touch into incorrect terms used when talking about physician assisted suicide. Those terms include suicide and euthanasia, just because they take on different meanings when said alone. So the fact that they are associated with this assisted suicide option kind of sounds immoral or politically incorrect. This was taken from a website, Death with Dignity. Now, we've already talked about pros of legalizing and debates of assisted suicide, and also the incorrect terms associated. Lastly, I kind of want to move into the effects of having the option of legal assisted suicide for the terminally ill. This country has a long way to go as far as legalizing suicide for terminally ill. And according to an article from the New York Times named Physician Aid in Dying Gains Acceptance in the U.S. by Paula Spann, the proportion of Americans have responded affirmatively, always a substantial majority, about being against assisted suicide. Clearly, yes, 44 states have still yet to legalize this option. She also states that even if a passage of a bill or ballot measures does not make it aid in dying broadly available to those who want it. So even if it does pass in your state, it's either going to be really hard to come by or not even possible for you to find it. So now that we know that, having the right to die, according to an article, Death by Dignity Act, a terminally ill patient right to die, it is believed that the patients who have untreatable diseases have the right to choose to hasten their own deaths to prevent further pain and suffering. So basically, people want to die on their own terms. Who's to blame them, right? Many patients do not think of this as an option because it goes against their morals and beliefs, which is completely understandable, as taken from a quote in an article, The Right to Die, by The Economists. The argument is immoral and absolute. Deliberately ending human life is wrong because life is sacred and the endurance of suffering confers its own dignity. So basically, you should be able to withstand all the pain and suffering until it's time for you to pass, because there is a time for everybody to pass. When patients do decide this option in passing, they wish to die with dignity And most patients who are seeking this option do not have the ability to attempt suicide. Terminally ill patients don't know how to go about a successful suicide, which is why more than a quarter of terminally ill patients have seriously thought about physician suicide, and nearly 12% have discovered these interventions have discussed these interventions with physicians. This was taken from a scholarly journal by E.J. Emanuel, he's an MD, as well as E.R. Daniels, MD. Uh, Finally, the patients find comfort in knowing that suicide will be approved by professionals, because nobody wants to pass and not know the proper procedures. Finally, I just want to conclude with people who find death, this option, as a con, have not seen loved ones in pain and suffering. There are plenty of debates and polls about this issue since it's very controversial, but this issue is not being right or wrong. And finally, no one deserves to pass with pain and suffering, especially if you're terminally ill. If it's time for you to pass, then you should do so freely without being judged for it or without having the physician being penalized for doing the final request. Thank you guys.